He's the first patient for the day. A follow-up. He came to us in August last year with moderate to severe sensory neural hearing loss. He came to us in August last year with moderate to severe sensory neural hearing loss. This had started since about 8 years back. Obviously, he has got a lot of difficulty in hearing, as well as there is a lot of tinnitus in both the ears. One of the major things he mentioned that he was a bus driver for a long time. He used to drive the bus, the public bus. And after the tinnitus has started, one of the major things which he said that what affected him was the loud noise, was the sound. And he left his job because he couldn't bear that sound which was troubling him. So that was one of the major concerns for him. He also had some shoulder pain. Which was worse from raising the arm. Kon hate batha? Kon hate batha? Right side. He also has some headache which is associated with the tinnitus. Frankly, I didn't have much constitutional symptoms in this case, right? Initially, he came to me in August, right? I thought that because he has been exposed to that loud, deafening noise so long, for a prolonged period of time, and that could have an impact on the entire hearing system. So I interpreted that as a shock, and I started the case with arnica. You're with me? The constant exposure to loud noise, constant exposure to deafening noise, resulting in tinnitus to develop, resulting in hearing loss to develop, interpreting that as a shock to the system. You're with me? I started with arnica 200C followed by 1M, considering the etiology, considering the causation. I've shared this with you many times. DM Fobister's words, whenever you're prescribing on etiology, prescribe 2 potencies. 200C followed by 1M. That was in August. There was no change, absolutely no change in the first follow-up. I went up to 1M followed by 10M. I went up to 1M followed by 10M in September. But again, there was unfortunately no change as well with that. At that point of time, he mentioned that one of the things which was really affecting him was that sound was still worsening him. He was not in the job anymore. But even if there was any light noise, even if there was any movement of the utensils, even if there was any honking outside he heard, that still affected him. And he almost couldn't get out of the home. You're with me? I changed the plan of treatment. I prescribed him Theridion. I want you to have a look in Borike for this medicine, Theridion, Theridion. I'll just write it down. This is the medicine, Theridion. Theridion is a spider. And my friends, no other medicine in the entire Materia Medica has this kind of sensitiveness to sound. I've written the name of the medicine, Theridion. There's so much sensitive to sound, they almost can't go out because any kind of sound, it almost goes straight through the bone. It's like that. So if you see in Theridion, extreme hypersensitiveness to sound. And Theridion is also a medicine which we prescribe for Meniere's, where you have the combination of vertigo with the tinnitus. But the catch phrase or the catch word for Theridion is the extreme hypersensitiveness to sound. If you see in Allen's, if you're there in Allen's for Theridion, there is a line, every sound penetrates to the whole body. So that kind of hypersensitiveness to sound you will find in Theridion. Every sound penetrates to the whole body. There was, yes, there was no rupture of the eardrum as such, but as the reports mentioned about the hearing loss, there was some structural change as well. He hasn't brought the reports. There was some structural change as well. Yeah, it did. There was some structural change as well, and he had been to a conventional. He had been to a conventional doctor, ear specialist, and he mentioned that as well in his notes. So that was also a factor. But at that point of time, the sensitiveness was so prominent, I ignored any constitutional symptoms as well, and I went ahead with Theridion.
Sorry.
Yeah.
There was inflammation.
There was no inflammation as such, no. There was no inflammation.
That would be unusual, isn't it?
Maybe earlier when he started off he had that, but there was no inflammation or like any discharge at that point of time when he came to us.
Amazing.
Yeah. Earlier on maybe he had that, possibly. Right. You're with me for Theridion? I want you to try this medicine. You can put this in your clinical tips for tinnitus. You can put this in your clinical tips for Meniere's. I started off with 200C in October. You heard me, Arnica, I tried 200C 1M, 1M, 10M. There was no change with Arnica, August and September. So I went on to Theridion 200C in October. Theridion has helped him with the sensitiveness, the extreme hypersensitivity to noise. Theridion has helped with that. আগে যে আওয়াজের সমস্যা হতো সেটা কমেছে আগের থেকে আওয়াজের সমস্যা হতো কানে শুনতেটা অসুবিধা আছে The hearing loss is still there. He mentioned there has been no change with the hearing. Sorry, yeah. He has hearing difficulty, but also he is very much affected by by loud noises. So if you have a conversation with him, he can't hear it. But whenever there is any loud honking or if there is any loud noise, that goes straight through him, and that affects him a lot. So there is a combination of poor hearing along with the hypersensitiveness to any loud sound. You can say that, but you get some people who have tinnitus who are very hypersensitive to sound. So you expect deafness to be there, but that's the uncommon aspect of prescribing Theridion. Although they have deafness, but they are very hypersensitive to loud noises. You're with me? So Theridion 200C was prescribed. That has helped with this hypersensitiveness. I have gone up to 1M in December. But frankly, I've shared with him that we may have very little to help you with the deafness, because it's quite a, I generally ask them to do the audiometry. If it's mild sensorineural hearing loss, then there is chances, or moderate. But here is, you understand, it's like a disability where it's quite severe. You saw it's mentioned there. So I've already told him that we can help you with getting rid of the hypersensitiveness, but to be very honest, there is little chance of getting you back to what you could hear in terms of that.
But he heard your questions.
Yeah, it's not really bad, but it's quite bad, in that way.
Does he work now?
কাজ করেন এখন? কাজ করেন এখন? কি কাজ করেন? It does some clerical work now, official work. The question was what job he does now. He's not in the bus anymore. He works in an office in a clerical work. Okay. Theridion 1M was the last prescription in December. It's too early. I am boosting today. The sensitiveness is gradually getting better, but we haven't had any change with the hearing loss. So, yeah. But it's a natrum constitution. Natrum salicyclicum we prescribe generally with natrum constitution. But here it's more like the sensitiveness, that's why we went for Theridion. The question was natrum salicyclicum in tinnitus. I shared that natrum salicyclicum is a medicine which you prescribe if you have tinnitus in a natrum constitution.
There are three trials, three trials in the book, like your natrum salicylate.
But Theridion is just for the hypersensitiveness to the loud noises. Okay. We are boosting today. If the hypersensitiveness goes away with Theridion, we'll go to a constitutional medicine after that, because Theridion has done what it could, and after that we'll go to a constitutional medicine. We got the name of the medicine, natrum salicyclicum, SALICYCLICUM, salicyclicum. This is the name of the medicine. Natrum salicyclicum is a medicine for tinnitus in a natrum constitution, with all the emotionals and the physicals of natrum. Salicyclicum. Salicylic group of medicines in general works well for tinnitus. If you have a look in salicylic acid, there is also a medicine which you prescribe for tinnitus. So salicylic group of medicines works generally well for tinnitus. I want you to have a look in salicylic acid, please. Salicylic acid. You see it's mentioned in Borike about the tinnitus and Meniere's. So if you have, like a typical constitution of natrum or any other constitution, you can combine that with salicylic group and prescribe it if you have a tinnitus in the person. Are you there with salicylic acid?
Yeah.
You'll see it's mentioned in the introduction. Symptoms point to its use in Meniere's, tinnitus, deafness. If you see in ears, roaring and ringing in the ears. It's a wonderful medicine for post-viral tinnitus. So you had any viral infection, you had any flu, after that tinnitus is still there. You can put this in your clinical tips as well. Post-flu tinnitus or post any viral infection, if you have tinnitus to develop, that's salicylic acid. Yes, 200C. Yes, yes, 200C1M. So I shared with you 3 medicines for tinnitus today. You can put this in your clinical tips, tinnitus and Meniere's. I shared with you Theridion, extreme hypersensitiveness to sound. I shared with you natrum salicyclicum if you have tinnitus in a natrum constitution. And I shared with you salicylic acid, specially useful for post-flu tinnitus. If you see in the introduction, it mentions about influenza. You got that? If you see in the introduction, prostration after flu, also tinnitus. So after flu, tinnitus can develop in salicylic acid. And you understand it because it's an acid, so the debility is there. And all of these work well, 200C, 1M, even up to 10M and 50M. All right? We are boosting today. Theridion 1M was the last prescription.